So this was a 48-year-old gentleman who had a road traffic accident, complaints of significant pain around the knee and difficulty in bearing weight. No, this is, you see carefully, I mean, although the X-ray may look very, very sinister, if you look into it carefully, we are seeing a double shadow of the lateral plateau of proximal tibia. Now, that tells us that there is some fracture. In the lateral view, what many of us tend to miss is actually this particular thing, which is, I will remove that line and then you will be able to understand that this is actually the articular surface which is depressed. So we have one condyle, other condyle, and then some part of depressed fracture. So that's what we need to address. Also keep a note on a bone island like thing which this patient already has. Now it's not pathological, but this patient already has that. This, I mean, in later on in our during the presentation, you will see that in CM and you may get confused that this is a depressed fragment, but it is not. It is a pre-existing thing that he has, of course, incidental finding. All right. So how do we proceed with proximal tibia fractures? Of course, the first and foremost, we need to get a CT scan because that tells us whether this patient requires surgery at all, number one. Number two, if it requires surgery, what all things are broken and what all needs to be addressed. So axial cuts, we all know our lowest classification. So that's your medial, that's your lateral, and that's posterior. And then we have posterolateral, posteromedial here and posterior.